Coming up on American Medicine Today, dementia may be preventable in up to half the number of people who become affected by the illness. Dr. Emily Kliansky joins us to discuss the 45 years of research that have led to this breakthrough revelation. Then Deborah was suffering from lower back pain that caused her drop foot while walking. Thanks to the Bonati spine procedures, she is happy to be back to walking and enjoying life pain-free. Finally, Dr. Bonati highlights a rare disease known as arachnoiditis. We discuss what actually causes the pain and how he is able to treat it. Coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome back to American Medicine Today. I am Ethan Euchre, joined by world-renowned orthopedic surgeon Dr. Alfred Bonati. So a new book, which is the culmination of 45 years of clinical evaluation and treatment in the field of dementia, is proving that the disease is preventable in half of people. Joining us to discuss is Dr. Emily Kliansky, MD, internal medicine physician and co-author of the new book, Dementia Prevention, Using Your Head to Save Your Brain. Thanks for joining us, Dr. Kliansky.
Thank you for inviting me.
Of course. So tell us about your work. You team up with your husband, Mitchell, I believe, and together You've treated more than 25,000 patients over the years, and you even developed a screening test of your own, which has been used by hundreds of doctors. Can you talk about that a little bit?
Well, sure we can. And actually, the screening test developed out of our clinical practices because, as most doctors are aware, it's hard to identify dementia very, very quickly. You could certainly send a patient to a neuropsychologist for 4 hours worth of testing, but that's pretty expensive and time consuming. So what we did was we came up with a 5-minute test that basically replicates the information you can get out of 4 hours of neuropsych testing and establish whether the patient is got normal cognition, whether they have mild cognitive impairment, or whether they're at a certain level of dementia, whether it's mild, moderate, or severe. The important thing is that a doctor can take action on that at that particular point. We're getting ready to roll that out to the public, though. Somewhere in the next 6 months to a year, we're going to make a very user-friendly, family-friendly, available version that can be used on any computer or iPhone or whatever, or platform essentially, so that concerned family members and spouses and friends can do a quick test of their loved one and then take it to the doctor and say, look, this is what this test said. Don't you think we ought to, get mom looked at a little bit more closely?
Because obviously early detection is very important. And if you have the means to do so at home, even better. Let's get into the science of all of this behind not only your book, but dementia. Describe the brain's function and how it's actually affected by everything from blood circulation to your blood pressure to your sugar levels and even medications. Can you talk about that?
Well, you just did a good job of outlining everything that really does impact our brain.
Time to go home. All right.
Excellent job, Ethan.
Thank you.
But, the other things that impact how our brain functions as a thinking machine for us involves our genes. Certainly, we can't pick our parents, so we can't change that.
That's for sure.
And it also involves early life trauma, whether that trauma be emotional, physical, or neglect, or whether it's the trauma that you get as a kid from hurtling over the bike handlebars or taking hits on a soccer field or a football field. And then you move into those kind of problems that you reach in middle age, which is generally high blood pressure, diabetes, bad cholesterol levels, lack of exercise, which is a matter of choice. Obesity is another one. Sleep apnea is another one. Anything that affects the ability of that brain to get oxygen, to get a good blood supply, and to not have toxins build up in it will cause an earlier onset of dementia. If you can modify those factors, what the science has told us is that you can prevent 1 out of 2 cases of dementia in the United States. That's huge.
That is huge. Just to touch upon a point that you mentioned, breathing. I actually saw in the notes here something about how the way you breathe while you sleep can either protect or harm your brain. Explain that, please. And also, if I'm sleeping, how the heck am I supposed to monitor how I'm breathing so that I'm not causing harm?
And you're not. That's the good question. But there are ways of doing it. A smart doctor can order first of all, an overnight pulse oximetry, which checks your heart rate at the same time it's checking your oxygen level while you're sleeping, records that data so that your doctor can get a report and say, gee, somewhere around 3 o'clock in the morning, you lost your oxygen levels. A more sophisticated and the way to diagnose obstructive sleep apnea is with a polysomnogram or a sleep study, which actually can be done in your own bed at home. And that's what a doctor can use to say, gee, 6 times an hour, you're losing your oxygen levels significantly. That's like somebody, Ethan, putting a pillow over your head and holding it there till your oxygen level drops. This is what's important about hypoxia or the lack of oxygen in the brain.
Mm-hmm.
We've known since 2006 that when you have a lack of oxygen in the human brain, you have an immediate uptick in the production of beta amyloid. That's a bad protein that actually is toxic to brain cells. We find that protein in the brain cells of patients with Alzheimer's disease and also with vascular dementia, the kind of dementia that happens when your blood vessels get clogged up by bad cholesterol, by lack of oxygen, by too many sugars in your bloodstream. So it's damage to the blood vessels. So if you prevent the oxygen deficit in the brain, you can stop the production of beta amyloid. That's one of the magic keys to it. The other thing is that how we breathe at night, whether we have enough oxygen in our brains or not, affects things like leptin and ghrelin. These are hormones released in the brain that control our appetite and our satiety signals. So when you don't have enough oxygen, you're releasing too much ghrelin. And like a monster, it basically sits there and says, I want you to feed me all the time. And it doesn't send any I'm full signals to your brain to tell you to stop eating. So there's a real correlation between lack of oxygen in the brain and obesity. And it does relate, of course, to exercise as well, because people who don't get enough exercise tend not to sleep as well at night as they should. That's different than not getting enough oxygen.
You also talk about in your book, apparently there's 20 factors that impact your dementia risk. And apparently like 17 of those are actually changeable once you reach adulthood. Obviously, we don't have time to touch on all 20, but can you kind of summarize and maybe give us a couple of those?
Right. And you actually started it off by talking about high blood pressure, bad cholesterol, diabetes, even high normal levels of blood sugar are proven to increase the rate of dementia and the earlier onset of it. The other thing is lack of exercise. Obesity, even in childhood, can impact cognitive development as well as the ability to think in your later stages of life. Other things that are important that you're going to need your doctor's help with are things like checking homocysteine, which is an amino acid that when it's too high is known to cause heart attacks in young men, but more importantly is a direct cause of dementia and is reversible. B12 deficiency, when checked by a methylmalonic acid, a very sensitive test, more sensitive than just a B12 assay. Iron deficiency is another thing that can cause dementing processes in the brain. Vitamin D deficiency is another thing. Of course, there's the toxins that we do have some control over, such as tobacco and alcohol and marijuana, not to mention other drugs that are illegal substances such as heroin and cocaine. And speaking of drugs, there are drugs that are quite legal that you can go into the store and buy because you're having trouble sleeping at night. And so you pick up that X brand with a PM behind its name, and it's got Benadryl in it, diphenhydramine, which is known to cause cognitive impairment, as well as the sleep drugs that a lot of doctors prescribe, and drugs used for urinary incontinence that may dry you up when you want to be dry, but unfortunately it's also drying up your brain and they oppose acetylcholine, very necessary neurotransmitter that we know is deficit in dementia cases.
Well, thank you for joining us, Dr. Emily Kliansky, MD, internal medicine physician, co-author of the new book, Dementia Prevention, Using Your Head to Save Your Brain. Thank you for joining us.
Great to be with you.
Absolutely.
Take care.
Stay tuned. After the break, you'll hear a story of recovery. You're listening to and watching American Medicine Today.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect 98.75% patient satisfaction. 75,000 procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Visit AskBonati.com. Welcome back to American Medicine Today. I'm Kimberly Bromell Bonati, and I'd like to welcome to the program from Bridgeport, West Virginia, Deborah Vaughn. Thank you for joining us, Deborah.
Thank you for having me.
So, Deborah, why don't you tell us what started your pain?
I believe it was just degeneration over time.
Can you tell us what type of pain you were having and for how long?
Well, for about the last 10 years, I've been having just like minor back pain. And then it's just kind of been getting, a little bit worse.
So let me backtrack you for a minute. Now, when you were talking about severe pain, apparently it was radiating, right?
About 2 years ago, I started having severe leg pain.
Ooh.
To the point to where it felt like my leg was not even connecting properly, and I was having to drag my left leg. And I was up like every night, all night with pain, just constantly, and going to the doctor and being misdiagnosed, and everybody just wanted to give me pain medications.
Because it was in your hips and then down to your leg into the knee, was it also affecting your foot?
Yeah. Yes.
Okay. And then you talk about trying all different things and people misdiagnosing you. Can you just tell anyone that's watching what type of conservative treatments that you underwent?
Yes. First, they put me on muscle relaxers,
Okay.
and then they put me on pain medications. I went for injections in my back. They put me on gabapentin. They sent me to physical therapy, and nothing seemed to work. It just seemed to get worse.
Right, because when you're on medications, you compound problems and you're just really masking the pain. But tell me, did any other doctors say that they could help you or?
No, I had 2 different surgeons that I went to told me that they did not want to operate on me, that they just wanted me to just keep getting the injections.
Huh.
The one told me that when it got so severe that I couldn't stand it anymore, that they would operate and put in pins and all that kind of stuff. And that was just
hardware.
not the route I wanted to go.
Well, you're very lucky you said no, because 1-level fusions fail 65% of the time and 2 to 3-level fusions fail 85% of the time. And what's really weird is that your doctor said they could do nothing to really help you, except have you say yes to invasive hardware fusion surgeries. Well, thank goodness you didn't go that path. Now, why don't you tell us about the path you chose to take?
Was about to lose hope that anything could be done. And I was watching Newsmax and I saw a commercial and it was Dr. Bonati, and they were talking about how they could do the surgery without using all the hardware, and that there was new technology. And so I thought, what have I got to lose? I'm just going to give them a call and see if they can help me. So I did. I called and I told them what was going on, and sent my records and everything in. And Dr. Bonati called me back and he said, I can help you. Come on down.
What was it like to finally be told by a doctor that something could be done?
Well, I felt like I was getting my life back.
So why don't you tell us what it was like hearing over the phone that you could get your life back, and then you travel all the way from West Virginia to Hudson, Florida, just north of the Tampa Bay area, and now you're face to face with the surgeon in the evaluation room that's telling you that same thing. And then, can you kind of walk us through the surgery?
Well, from the minute that we got there, we were greeted and just treated like he really cared about us. And they just took me to all the different places I needed to go to and got in with the surgeon. And he had looked over everything and taken the time, that was needed. And he sat us down and he said, this is exactly what's going on. He showed us, the pictures and told us the procedures and everything that needed to be done, and scheduled it for 2 days later. And so I came in for the day of surgery, and they explained everything to me that was going to happen. So I was very aware of, what was going to be happening, and that relieved a lot of the fear. And then I, got on the table and everything, and they started. And honestly, it was just a great experience for me. And I'm just so thankful for Dr. Bonati and for the clinic. And I just, I'm so thankful to have my life back.
Aw. Well, you're a gleaming example of why Dr. Bonati got out of traditional spine surgery and created his own exclusive patented Bonati spine procedures, which was, to put the patient in the forefront of his mind and to relieve the pain. Now, they utilize something called conscious IV sedation, where the patient is sedated, but they're awake and able to communicate, and they are given the opportunity to watch. Now, some people remember everything, and some people remember bits and pieces, but what was that experience like for you?
I remember the beginning. They told me, if I feel pain in my back, say back, and if I feel pain in my leg, say leg. And so I remember doing that a few times.
Now, why don't you tell me, when did you notice a relief of the pain that brought you into the Bonati Spine Institute? And they bring you straight to recovery, so tell us what those first steps were like. And when did you notice you were better?
The first steps, of course, I was still very sore and everything, so I could not tell a difference until later that evening when I was in the hotel. And after I had gotten up and was walking around some, it was like the leg pain is not there. Mm-hmm. It's gone already. And from that point on, I've not had it ever again.
And you say leg pain, but were you dragging your foot?
It was gone. I mean, from the time that I left, it was gone.
So from Bonati to the hotel, your pain was gone and there was no more dragging your foot. So when you were released, did they have you wearing any sort of back brace?
No, I did not.
Well, all right. That's because we tell people to just be up and walking, to ambulate, because that helps the body heal and there's no need for any types of devices. So thank you so much for sharing your story of recovery with us, Deborah. And we're so happy to hear that you've regained your strength and gotten back in motion.
Well, thank you so much. And thank you, Dr. Bonati.
And I also hear that congratulations are in order because you're a new grandma.
Thank you.
If you would like to hear more stories just like Deborah's, go to YouTube and visit the Bonati Spine Institute. And if you'd like to find out if you're a candidate for the Bonati Spine procedures, visit askbonati.com.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, So 6 days, and everybody wasn't all like, "Didn't you just get out of surgery?" I'm like, "Yeah. I feel great."
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. So, Dr. Bonati, we have a ton of questions online, and we see cases that have something called arachnoiditis. Why don't you explain what that is and how you treat it?
Arachnoiditis is a type of a radiological finding, usually occur when a patient has several types of inflammatory process on the spine, sometimes surgery, and then create an inflammatory process inside of the roots, inside of the canal, inside of the dura.
Oh,
So
in the dura?
in the dura, inside of the dura,
Ooh,
where
okay.
all the nerves are located.
Sure.
And when that happens, the idea is a radiological finding where they see that the nerves become together and become like a cluster.
Okay.
And the neurologist and the neurosurgeon and orthopedic surgeons, we believe that that can be the cause of an intractable pain. Some people are walking with this pain, and everybody, if they have the sign of arachnoiditis or they have a lot of surgeries, they decided to do an MRI, and they look at the MRI on an axial view, and they look at the nerves. And if the nerves are in a cluster, they blame that situation to the cause of the pain.
Okay.
Usually the treatment is pain medication, and the patients suffer of this pain in a permanent basis.
Right, because it never goes away. They're just masking it.
Well, it's constant pain. And if you have surgeries, more surgery is not going to help you. At least that's what
They say.
that is what is the tendency today.
Okay.
There are articles that they discuss this. There are patients that they have arachnoiditis, and they usually were patients that have 2 or 3 operations on the back, and the pain is practically intractable.
And so how do you treat it? What are you doing differently than everybody else in the marketplace?
I found that when the people start to talk about symptoms that they cannot treat, I always think it's because they don't know really the cause. And it's easy to put a name on the forehead of the patient when you don't know how to treat that patient and say, you have arthritis. But if you say you have arthritis and that is enough to tell you that I cannot treat you, then you're going to live the rest of your life saying, I have arthritis and that's my pain.
Right.
Because you trust in what they tell you. And it's not because they have bad faith telling you that. It's because
They don't know.
That's what they learn in medicine in training from the teachers and went back to their practice.
But what makes you so different? What gives you that insight to realize that something can be done?
Because I always think that when somebody is so radical than to say, you cannot do that because, that's when exactly I'm going to put my fingers to say if it is true.
Okay.
If you are able not to separate those areas, but if you are able to remove the pain, the inflammation will come down. And if inflammation comes down, the body will react and probably separate those nerves again. Is that really the pain? I don't really think so. I think it's a misdiagnosis, a failure of a back surgery, and a finding in radiology that makes the mistake. So it's not the doctor doesn't know, it's the doctor is following the rules of his knowledge.
Okay, but what are your rules? Because your rules are different.
Well, my rules are not different. I go to the same thing. The problem is I try to go farther and say, this can be something else. And if the problem is that you have an inflammation, and the inflammation is the cause of the pain,
yes,
and it will reduce the inflammation, maybe the body will take over and correct the problem. There are other illnesses and other situations that they are very similar. For example, reflex sympathetic dystrophy.
Okay.
It's another situation that has the type of a problem. Not a cluster, but just a permanent pain.
And it causes swelling, right?
Well, any inflammation will create swelling. So I believe that if we can remove the specific pain, so what you need to do is you need to find the specific nerve. Which nerve is the area that the patient is suffering with? That's a dermatome. If you can identify the dermatome or the several dermatomes created by that, and you can manipulate the nerve, I thought probably will help pain. I don't have enough experience, but I have 2 cases that we did something like that. And the results were some sort of astonishing because the patient had immediate resolution of those pains.
Okay.
And the diagnosis was arachnoiditis. And when you look at the MRI, yes, you will believe that it's arachnoiditis. At least the description, radiological description of arachnoiditis.
Yes.
So that's the way that I always work. Tell me that is very difficult, and I'm going to try to see if I can help.
So when you treat that, are you giving more room to the nerves, or are you...
You're reducing the inflammation.
But how?
Because you open the canal of the foramen.
Okay.
And if the nerve that is hurting now is release of pressure, probably that can create the removal of the inflammation. And if you remove the pain and you remove the inflammation, you don't have an arachnoiditis.
So you've never been happy just living by the status quo. If doctors say, can't be treated, live in pain, you go, no, wait a minute. And you figure it out. You care enough about the patient to try and help. And that's what real medicine is about. And that's what makes what you do and the Bonati spine procedures so darn effective. 98.75% patient-reported success. Not just you patting yourself on the back saying, yay, we're successful, but patient-reported success. If you want to know if you're a candidate for the Bonati spine procedures, visit askbonati.com. And if you want to see patients who have recovered from such problems like arachnoiditis, you can search YouTube, find the Bonati Spine Institute. You're listening to American Medicine Today. If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.